So what you can see on the screen is a farmer trying to arrange the hay that he has collected, right? So there are many farmers who are into this kind of job, and people who are into this kind of job, they have a tendency to suffer a problem. What you can see on the screen is a farmer who is suffering some kind of chest problem. So he has put his arms on the chest, and he is also having cough, right? So these are the frequent problems that the farmers might develop over a period of time. And for all these problems, the organs that are responsible, that is present inside our body, is the lungs. Exactly. So the lungs get involved in these people who are into farming for longer durations of time. And so the disease that we are going to discuss today obviously is a part of the syllabus of MAKAUT for the 6th semester students. The name of the disease, mostly affecting the farmers and mostly affecting the lungs. That's why the disease is named as the farmer's lung. Exactly. The disease is named as the farmer's lung. So what is farmer's lung? Farmer's lung has been defined as is shown in the screen. Farmer's lung is a type of hypersensitivity pneumonitis. It's a hypersensitivity pneumonitis, that is an immunologically mediated inflammatory disease of the terminal airways of lungs, right? It is also known as extrinsic allergic alveolitis. Now, since this part of the body is where the farmer lung affects, let us take a look of where this part is present inside our body. We'll be taking the help of this background of the hair, on which we'll be playing in a short video to describe what those terminal airways are. So in this video, what you see is a human being, and these are the lungs of the human beings, and in between these two lungs here is a tube. The tube is known as trachea, and the tube bifurcates into two sides, the two bronchi. Let us have a look of how this actually happens. What you can see is the lungs inflating and deflating, and the lungs are variously colored. So what you find is the bronchi, and at the end of the bronchi are the bronchioles. So we are now near the terminal ways, right? So these are the terminal ways. And now on the screen what you can see is the spores of the bacteria that can cause the farmer's lung. Let us find out what particular spores are responsible for the causation of farmer's lung. There are basically two types of bacteria. The spores of these two types can cause farmer lung. The names of these bacteria are, number 1, Micropolyspora fini, and number 2, Thermoactinomyces vulgaris. These two both are bacteria. Apart from these two bacteria, we have something called fungus, commonly known as molds. Now these molds belongs to the genus Aspergillus. So all these three in the violet on the screen are the major causes of farmer lungs. Now there are a few more additional detail that one should know before we learn the further things of the farmer lung. Where the crops are harvested in wet or rainy weather, what happens? Crops usually undergo self-heating. So crops heat up by this water. Okay, that is water is available in the rainy weather or in the wet weather, and with the help of this water, the crop undergoes self-heating when they are stored. On the background, what you see is the stored haystack, and if this haystack accumulates some amount of water, this will be heating itself up. Now when this happens, the heat tolerating bacteria and molds grow rapidly and cause spoilage. So these dark areas, what you can see on the backgrounds, are basically the areas where the heat tolerating bacteria and molds has grown. After their growth, they would spoil the hay up. Once spoiled, the wet hay now dries. So as spoiled hay dries, it now becomes dark, that is, it darkens. It crumbles easily. That means it is very much breakable, very much fragile. And in that way, it is extremely dusty. So a lot amount of dust can come out from this dark, crumbling area of the hay. Now this dust contains bacteria and mold spores, and these spores are extremely fine. So this dust that contains bacteria and mold spores is extremely fine. This point needs to be noted. Fine. This is extremely fine. This is so very fine that people can breathe these spores into the innermost regions of the lungs, that is the alveoli, where the problem begins. Which problem? The problem of the farmer's lung begins in the alveoli. Remember, in the optional name for the farmer's lungs, we have the word called alveolitis. So basically, farmer's lung is a alveolitis. Okay. So the summary of this section would be that there is some amount of hay which, on accumulation of water, allows bacteria and mold to grow in it, and after that hay dries up, the bacteria and mold gets converted into fine dust, and that dust, when inhaled, it enters the alveoli of the farmer, and thus it causes the farmer's lung. Now, how does it happen? That means we are now speaking of the mechanism that goes on inside the body of the farmer's lung. We have a description out here. We'll be reading this description. The spores that cause farmer's lung are not infectious. That means if you stand somebody who is already having farmer's lung, you would not get the disease itself. So what do the spores do? They trigger an allergic reaction. What are allergic reactions? It is given here. Allergic reactions are produced by the immune system, that is, the body's defense system that normally protects against infectious diseases. The immune system reacts when special substances called antigens enter the body. Antigens are usually found on germs such as infectious bacteria or viruses. The immune system reacts to neutralize these germs and prevent infections. Antigens are also found on harmless materials such as mold spores, something that is responsible for farmer's lung. Sometimes the immune system will react against these by producing a harmful reaction. Example, the allergic reaction that exactly is produced in the farmer's lung. And this reaction is produced against an antigen attached to material like a spore that is otherwise harmless. So it's basically the body's own immune system that has a vital role in farmer's lung. What is the role? We'll be observing just short a while. Now we shall look into how is this produced, how is the disease is produced in the body of the patient. Something that the medical people termed as pathogenesis. Okay. Now, there are two steps in the pathogenesis. Here we are discussing the step number 1. As a description, you find it's written as that farmer's lung develops in 2 steps, as other allergic reactions do. The first time a person inhales a large amount of dust and spores from moldy hay, the immune system often responds by producing specific antibodies against the antigens. Antibodies are chemicals that circulate in the blood and attack specific antigens. Once the body has produced these antibodies, there is a chance that further exposure to moldy dust can generate a hypersensitive type of allergic reaction. And this hypersensitive type of allergic reaction is a reaction that is typical of farmer's lung. So whatever has been described out here has been summarized in this diagram. The antibodies having the chemical nature of immunoglobulins, so these are the antibodies. Okay. Now these antibodies do have a role in the first step of the pathogenesis of farmer's lung. The antibodies normally tries to protect any kind of germs that is carrying antigen along with it. That is the normal function of your immune system. But when there is an allergic reaction, that means the reaction is more. When does it happen? When there is a further exposure to moldy dust. I am hovering the mouse around this area. When there is a further exposure to a moldy dust, then there is a hypersensitivity type of allergic reaction. And this reaction is the typical reaction of farmer's lung. So that is the summary, a short summary of the step 1 of the pathogenesis. Now let us find what happens in the step 2. In the step 2, there is a development of immune complexes. So how does it develop? Let us find out in this description. It develops by a hypersensitive reaction. So this is triggered when antigens in the lungs react with antibodies that circulate in the blood. This sets off a complicated reaction normally intended to protect the lungs from infections. Certain types of white blood cells move into the lungs to attack the antigens. Then, other types of white blood cells move into the lungs, releasing chemicals and poisons that increase blood flow and kill lung tissue close to the antigens. So this is where the lung tissue is now being killed, and this damage causes swelling, inflammation, and damage to lung tissue, resulting in noticeable breathing problems, because as the lung tissues are progressively damaged, you do not have that large surface area across which the respiratory gases can exchange. So if the respiratory gases cannot exchange, obviously there will be a breathing problem in the body. So these are the 2 steps that are involved in the pathogenesis. Now we shall be looking into the 2 extreme types of the farmer's type. There obviously are 2 types. One is the acute type that I am to show you the next. This is the acute farmer's lung. What I show on the diagram is that the spores that are entering into the lungs, okay, and if it does, the symptoms are listed out here. If it occurs, the symptoms that will be found are listed out here. What are they? First is the fever, next is chills, next is a breathing difficulty, next is the rapid breathing, that means heightened rate of breathing. Technically we term it as tachypnea. Then the heart rate will increase, so the heart rate becomes rapid, and there will be a cough. The cough is dry in nature, that means this cough is not going to produce any kind of sputum. These acute symptoms can last up to 12 weeks or longer, but may ease after 12 hours. So after 12 hours, normally these symptoms are reduced in severity, but these symptoms doesn't go off in total. This last maybe for 12 or maybe for some longer duration of time. Now these symptoms are somehow similar with the disease that is called pneumonia. So acute farmer's lung is sometimes confused with pneumonia. We will learn in some other videos the diagnosis of farmer's lung. Then we should be understanding the differences or the methods of differentiating pneumonia from farmer's lung. Before moving on to the other topic, the other aspect of this disease, I must mention the very first line out here, that is, it is a more serious and intense attack. The acute farmer's lung is much more serious and much more intense. Okay, so with that, we now move to the other type of the farmer's lung, that is known as the chronic farmer's lung. We'll be coming to the diagram once we read the descriptions. First thing out here, it is given that after several episodes of acute farmer's lung, you may develop a chronic farmer's lung. So chronic farmer's lung is not something that develops in the very first instance. In the first instance, a farmer develops acute farmer's lung, and multiple episodes of acute farmer's lung leads to the development of chronic farmer's lung. Now these are the symptoms. I have listed the symptoms out here that will be found in the chronic farmer's lung. First is weight loss. Next, the energy would go low because the oxygen level is going low. And since the oxygen level is low, here we will find that the shortness of breath is increasing. So increasing shortness of breath. Gradually, this would result to weakness. The cough becomes chronic, and this condition can last months or even longer. And if the person is not avoiding the moldy dust, these particular symptoms may worsen. So it is given here the summary of this. The condition can last months or longer and worsen if you are still exposed to moldy dust. Fine. And finally, the dreadful thing is that there is a permanent lung damage that is possible with continued exposure. So people who are into the profession of farming, they have a history of continued exposure because they just can't leave their job overnight. Now since they can't leave their job overnight, so obviously the exposure would be a continued one, and with the continued one, the damage will be permanent. Now we shall look into the diagram that how this permanent damage takes place. Here we see the immunoglobulins molecules that are formed by the beta cells of the immune systems. Now beta cells are forming these molecules by a help from this kind of T cells known as the helper T cells. Now once these immunoglobulins are formed, and these immunoglobulins form complexes with the spores, this entire immune complex accumulates in the cell, and it causes inflammation and finally fibrosis. In some other video you will find description of fibrosis. In fact, there are many more things to know about farmer's lung which is beyond the scope of the present discussion. So I have given you the list of what else every student should know of the farmer's lung. Maybe in some other video, or maybe if somebody is willing me to contact personally for this particular topics, okay, I shall be discussing with him or her, and notes will also be available on this topic also. But in a brief, I am trying to list out those particular points of farmer's lungs that every student should know. First is the etiopathogenesis. Next is the epidemiology. Next is the diagnosis. That means how would a person know whether he or she is suffering from farmer's lung or not. Next is prognosis. That means if somebody is already diagnosed with the farmer's lung, what is the future course of events for that particular patient. Next is the management. That means those particular attempts or endeavors that can be undertaken so as to minimize the severity of suffering of the patient from a farmer's lung. Next are the different kinds of drugs and how those drugs can be used in the treatment of the farmer's lungs. Obviously, the final point is to prevent it, because prevention, as we all know, is better than cure. So prophylaxis deals with those methods that can be adopted to prevent the disease of farmer's lung. So with that very short listing, I should be putting an end to this video. Thanks for watching. And if you have any kind of suggestions, if you have any kind of feedbacks, then you might like to reach me. I give here my WhatsApp number. Here you can text all your feedbacks, all your suggestions. And if not am I reachable in this number, the comment box right below in this video is there only for you people to write any kind of suggestions or the feedbacks. I am also available for providing the notes on the topics that I am making videos upon. So if you people are interested in the notes, do contact. Thank you. Thanks to all for watching the video of the day. Bye-bye.